One Friday night, the 17-year-old me was excited as I was going on my first date. Little did I know that it would be the most embarrassing night of my life. My date had it all planned out. A nice quiet restaurant, then movies, and then we were going to drive to his aunt's house so I could meet her. The movie was great, a typical 2-hour action movie with loud noises and a lot of flashing lights. We drove to his aunt's house afterwards, and I remember feeling lightheaded and dizzy. As I proceeded out of the car, I fell to the ground unconscious. I'm not sure what happened after that, but when I woke, I was lying on his aunt's couch with her, my date, and my mom staring over me. I later discovered that I experienced my first migraine episode. Can you decipher the difference between a migraine and a headache? Many people experience headaches assuming that it is a migraine, and although they are both types of head pain, there is a difference between the two. According to GoodRx, almost any type of head pain can be called a headache. Migraine headaches, tension headaches, and cluster headaches are all three common types. Migraines aren't the same as the other types of headaches. Migraines have different causes and they need different treatments. You can tell the difference between a headache and a migraine just simply off the symptoms you're experiencing. The night that I encountered my first migraine was the beginning of my journey for learning the difference in treating the symptoms. As I mentioned earlier, I was feeling lightheaded and dizzy, and I was seeing what I now know to be auras. My migraine was called an ocular migraine. Today, I would like to provide the various kinds of migraines that exist, along with the range of symptoms and genetic factors that contribute to understanding your migraine. According to WebMD, there are 5 types of rare migraines, but overall, there are several different types. The rare migraines are hemiplegic migraine, migraine with brainstem aura, abdominal migraine, ocular migraine, and vestibular migraine. On average, 70 to 75% of people do not experience the auras. An aura is described as a collection of sensory disruptions, primarily visual, that may occur before or during a migraine headache. These disruptions can manifest visual alterations such as spots, flashes, and zigzag patterns, along with the other sensory or motor symptoms like numbness, tingling, or even difficulties with language. Auras do typically last 5 to 60 minutes. They can occur before the headache, preceding it by minutes to hours, during the headache, or sometimes even without a headache at all, which is also known as the acephalgic migraine. A hemiplegic migraine and abdominal migraine can also affect younger children, presenting with some symptoms such as pale skin, abdominal discomfort, nausea, and a reduced appetite in the case of an abdominal migraine. For a hemiplegic migraine, symptoms may include headaches, changes in vision, difficulties with speech, confusion, issues with muscle coordination, as well as nausea or vomiting. It is important to recognize these symptoms to ensure proper care and management. A migraine with brainstem aura presents similar symptoms, such as numbness or tingling that travels from your arm to your face, slurred speech, vertigo, ringing in the ears, and double vision. The vestibular migraine is well known for inducing vertigo, while the ocular migraine is characterized by auras, including flashes of light, blind spot, and seeing stars, which do not always precede the head pain. Now that you know the different rare types of migraines and their symptoms, let's discuss more on how to manage it. One might ask, how do you manage a migraine? Well, for me, I started with a migraine diary. It was tedious, but it helped me a lot. I was able to discover the certain foods I ate and flashing lights like the movie theaters triggered my episodes. According to the American Migraine Foundation, to receive an accurate diagnosis of your migraine and optimize treatment options, they do recommend keeping a migraine diary to provide to your doctor. This is more crucial for people that have frequent migraines. The diary can help identify patterns that could suggest episodic, chronic, or menstrual-related or other types of migraines, which will guide your doctor to the right treatment path. Avoiding triggers is harder than one might think. Triggers can be increased stress, loud noises, bright lights, strong smells, or weather changes. You may utilize virtual tools such as apps like Headspace and Calm to guide you on relaxation techniques. I personally like meditation and breathing techniques. Stress can also impact your sleep, which can be a trigger itself for migraines. Maintaining proper hydration and adhering to a balanced diet is of utmost importance. Consuming meals that are rich in protein, dietary fiber, and healthy fats while simultaneously reducing the intake of processed foods can significantly aid in preventing fluctuations in blood sugar levels, which may precipitate a migraine attack. It is generally advised that individuals who suffer from migraines should include electrolytes in their hydration regimen. Furthermore, for every cup of coffee consumed, whether it be morning, day, or night, it is advisable to increase water intake to ensure adequate hydration is achieved. Let us now examine the hereditary factors associated with migraines. Certain categories of migraines exhibit significant genetic associations. An individual may inherit a specific type of migraine known as familial hemiplegic migraine, or FHM, through an autosomal dominant inheritance pattern. This indicates that it is sufficient for an individual to receive just one copy of the mutated gene to develop FHM. However, possessing the mutation does not guarantee that one will experience FHM. As noted by Medical News Today, I would like to elaborate further on genetic connections associated with migraines, as I am not only experiencing these migraines myself, but my father and son have also been affected. Given my extensive experience with various medications, dietary modifications, and the reduction of screen time over the years, I can apply the knowledge I have gained to assist my son in identifying his specific triggers. Indeed, as noted by Medical News Today, awareness of one's genetic predisposition to migraines can facilitate a more prompt diagnosis and enable timely access to appropriate treatment. There exist four distinct types of familial hemiplegic migraine, with type 1 being the most prevalent, resulting from a mutation in the CACNA1A gene. Type 2 arises from mutations in the ATP1A2 gene, which is also associated with seizures. And type 3 is attributed to mutations in the SCN1A gene. A physician will diagnose FHM type 4 in instances where a genetic cause for FHM cannot be identified. I hope that the information provided today sheds light on migraines, and maybe if you're experiencing some of the symptoms yourself, you'll be encouraged to consult with your doctor. Today, I have summarized the hereditary components associated with migraines, the various types, and the distinct symptoms. I appreciate the awkward first date that I experienced, as it did help me recognize my uncommon migraine sooner and potentially avoid a risky situation.